I am going to show you a very useful tool that we have in AccuDent to set up all the files by the assistant to prepare the day of work. So if I go to a patient list, I click on a patient, I have the paper file of the patient, which is shown in the patient's card. So you click on patient's card, you have the name of the patient and all that. And then here you will see the file number. This is the paper file number, okay? Because there are things that you can do digitally and things which you cannot do digitally. This is why we have, until today, we have paper file. We try to reduce the number of paper we manipulate, of course, but we cannot remove 100%. And this is the reason why we still have paper file. And each patient has a different file number. So when we go to the chart, we have on top the patient's name, the age of the patient, the cast, where are the cast, if they have been given to the patient or scanned or deleted, okay? So you have also, next to this, the patient's file number. If the patient is part of an insurance company, let's say he's insured and is insured by AdNIC, for example, when you go on top here, you will see also the name of the insurance. So these are things with a direct access that you have when you open a patient's file. And the patient's file, the paper file, will be number 3. You cannot manipulate this. You cannot change the name at this level. You can only change the name at the level of the patient chart, okay? So when this is done, let's go to the diary. So tomorrow, I have to do this. I have all these patients, and the assistant needs to open the paper file of each of these patients. So how to do that? How to know? She's not going to open each of them and find the paper file number. So what we have been doing, we've been making a report. In report, you open report, you go down to the report and you click on patients list. And this will edit the list of the patient that you will have to open tomorrow or another day. So you select the day, we keep this one, and you make a search, and you will have now the list of all the patients that I will see tomorrow. If you want to print this, you can go here, you can print this, or you can save as PDF. I save it as PDF, save, and it is saved, and you have the patient list, which is done. And you have the patient name, the mobile number, and the file number. And you see all the file number are here, and you can call the patient if you need to remind them your appointment if they did not set up the automatic reminder by email and by SMS or by WhatsApp. So this is the way to get all the lists in a very simple way, and this will help the assistant to save a lot of time. I thank you for your attention.